Hello everyone. Today we're going to talk about a case recently we have seen in our clinic. A child with ADHD features. Okay, so ADHD, different names people usually call. That is, a hyperactivity disorder, attention deficit disorder, hyperkinesis. Or there are lots of changes, names people do use, but the problem itself has remained constant over the years. So as per the DSM-5, that is Diagnostic and Statistical Manual of Mental Disorders, if we consider, these are the following criteria should be there. So, parents usually they come, and then, when we take the history and then we talk and we observe the child, there are many things we usually see. So the child usually often fidgets with hands or feet, or they may find very difficult remaining seated when required to, easily distracted by external stimuli, and difficulty awaiting for turns in the group situation. Like before we talk, they often blurts out answers to questions, and also not only this, they find very difficult to follow the instructions from others. So sometimes this is seen as an oppositional behavior or failure to understand the direction. So we need to really look into it, and observe the child very keenly about. And also the child has difficulty sustaining attention in any task, like where you can also observe with the play activities. So it is difficult for them to shift from or any activity to complete. It will be very difficult. So, and also they find difficult playing quietly. They often talk excessively, interrupt or intrude others also. And what often doesn't seem to listen to what is being said actually. So they also lose things necessary for task or activities at school or home, like example toys, stationery, anything, assignments or books or etc. So they often likes to engage in physical dangerous activities, that is, they won't think about the possible consequences, and they just run into the streets without looking into it. So these are some of the ADHD, and proper assessment needs to be done actually. So in comparison with the age, the ADHD child has difficulty in concentration and paying attention. So when they come to the clinician, how actually it is diagnosed ADHD? When parents recall the development of their ADHD children, some report or that the child was excessively active even, like prior to birth. Some also describe a child was fussy and difficult from the start, while others recall boundless energy and intolerance of any kind of confinement. So these early patterns are important, and they may serve to alert us to the possibility of ADHD. There is no single behavior actually, or the single problem which predicts ADHD with absolute certainty. So, and there are checklist actual computerized tasks and brainwave measurements and other techniques are there which have been there. And more than that, I would say that proper diagnostic assessment has to be done with the clinical psychologist, and that would be more helpful to understand. So how it is actually done, I'll just want to summarize that. But first, when you go to a psychologist, they take the detailed history, a history of long-standing problems with attention, impulsivity, and excessive activity, that helps them to understand the pattern or concern with ADHD. And the family history is very important, since we know that there is a hereditary component in ADHD. And also the school behavior is very important here. It is very essential to obtain some kind of information or report from teachers or from the parents, the concerning the child's ability to finish the task or work or abide by rules and respect authorities in the classroom, since it is usually in the classroom setting in which the ADHD child's problems are like mostly observed by the teachers and others. This kind of information is very much important. And academic achievement in light of the relationship between the ADHD and learning difficulties. So sometimes it's important to assess the level of academic achievement in a children whom ADHD is suspected. Intelligence also, assessment for ADHD should include at least a screening of general intelligence to rule out sub-average intellectual functioning. Children who are below average in this regard are more likely to be and bewildered and frustrated by the complex demands of daily life at home and in school. Like emotional adjustments, since depression, anxiety disorders often coexist with ADHD, exploration of child's emotional status is necessary to rule out these conditions. Even though an ADHD child may not be clinically depressed, information about his emotional concerns can be very useful in formulating comprehensive treatment plan. Peer relations. Learning to make and keep friends is an important developmental task. Although many ADHD youngsters have no problem with it, a significant number do fare poorly. Again, information about poor social relationships can be useful in developing a good treatment plan. And child rearing practices, although child rearing practices do not cause the primary symptoms of ADHD, however, parents manage their children can make sometimes the problems much better or much worse. It is important too for parents to understand how these aspects of their own temperaments and personalities affect parent child interaction and child behavior. So apart from this, the medical history and evaluation also necessary. Although it is rare that other medical problems results in symptoms which mimic ADHD, the physician must be certain to rule out of physical disorders as a source of the problem. As a rule, however, there is no need for a full neurological evaluation or an EEG unless the physician suspect epilepsy. So overall, I just want to conclude this like whenever you see children like this behavior, all these emotional behavioral symptoms or attention deficits and all that, so please visit a clinical psychologist and then do assess properly and take the treatment, therapeutic treatment properly. Thank you very much. Sailaja signing off.